Now I want to talk about some goals, right? Some of the goals that are intended for each eating disorder, for individuals that have them to get better, for each one, right? With anorexia, I'm gonna start with that first. Anorexia, the goal is to get your BMI back to about 20. Because if you have anorexia, you most likely have an unhealthy BMI. So especially Jean, right? She ended up with 16.3 after she ended up losing all of that weight, getting down to about 94 pounds. So for Jean, right, especially getting her BMI back up to about 20, that's going to be, one of the, goals, as well as for anyone else who also has anorexia, not just Jean, but getting your calorie intake, your calorie intake up to 1,500 at least. And then that can progressively be increased as you do better. Weight gain is also a goal. The amount of weight you want to gain, though, that you want to look to gain is about 1 pound to 2 per week. Same thing with weight loss, though, conversely. If you want to drop weight, healthy weight loss is anywhere from 1 to 2 pounds per week. The goal for bulimia is to essentially improve your relationship with food. Part of the care team, a registered dietitian, nutritionist, or what have you, may, structure you a meal plan that, again, focuses on, your responses to hunger and satiety, right? Their focus is going to be to get you to get rid of your misperceptions of how you see food, right? You see good and bad and all that. That's their goal is for bulimia is to get you out of that, right? Is to sort of condition and tweak your mindset a little bit when it comes to food. Because with bulimia patients, that's typically what happens. They see food as bad, or they see it as something negative. They classify foods incorrectly. And last but not least, we have binge eating disorder. So with that, physical activity is going to be a goal, right? Because of course, with binge eating disorder, most individuals who have that disorder is, they tend to be obese, right? At least overweight, but at the most obese. Then you have control over eating habits. That's another goal for a binge eating disorder, to help, get better. Because essentially when it comes to binge eating, obviously, it's you're overeating and you're eating to the point where you have no control. You don't really know when to stop. Your care team that works with you, care team that works with a patient that has binge eating disorder is going to have to establish guidelines to get themselves. One example may be to, of course, structure themselves a meal plan, but not to the point where they're, restricting their eating. Restrictive eating, that's still not going to help binge eating disorders either. That can end up pushing a binge eating, patient the complete opposite direction.